Okay, my friend. Thank you for letting us record this because you are one of the first experiences our treatment in prostatitis combined with cystitis. You come to me maybe 1 year, more than 1 year before, and say that you have cystitis. I said to you, oh, in men this is not possible. It is prostatitis always. But you said because of the medications you use in the treatment of prostatitis that are causing retrograde ejaculation, maybe your prostatic inflammation moved into bladder, and you are having some cystitis symptoms, bladder irritations. So I said, okay, it may be, why not? And we did a cystoscopy to you, and we observed that there is prostatitis, prostatic inflammation is coming out, and additionally you have cystitis. You have the trigonitis issue, and we fulgurated this part, and we drained the prostate. So do you think this worked for you? How was your response after the procedure?
I think the fulguration worked for me for a while, but I think that there's probably mechanical reasons why I was getting an infection.
Yeah, you say you have a time without infection, without problems, and then it come back again because of the maybe a sexual activity or such a thing.
Yeah.
Yeah, actually, I don't totally agree with you in this, because in prostatitis we drain the prostate, we empty the prostate, and it after the next day it begins to fill again because we squeezed it, we emptied the channels and the ducts, the empty places in the prostate, we created an empty place, it begins to fill again. So in my prostatitis experience, I noticed that it needs a couple of interventions, squeezing the prostate again after some time. This may be 1 month after we need another prostate massage, maybe 3-4 times. Then send the patient home and ask him again 3 months. So you come to me how many months after the first procedure?
2 months, 3 months.
2 months, 3 months. Okay. You come again and we look inside again. At this look, the trigone, the bladder was healed.
Yeah.
It's good. And there was no, at the first cystoscopy, I see a real trigonitis, very inflamed, reddish trigone. And when we fulgurate, next time we see it is all clean, but the infection inside the prostate was still there, or it reoccurred. Is this because of your fault, some mistake? Even you do nothing wrong. I mean, having a sexual activity with condoms, such things, you would have the filling of the prostate again. In my view, it's like that. You are a very experienced in this infection subject. What's your opinion on what do you think about our treatment? How you want to continue? So you come here again. This is your third time? Third time, and it's really 1 year after the first operation, right?
Yeah.
So how is your symptoms now? What do you feel?
I would say.
How was it before?
Unmanageable.
Unmanageable.
Yeah.
Unmanageable because become manageable. How bad was it? What was your symptoms? How was your...
Just always on the toilet, constant frequency, constant urgency. Now it's controllable.
Was there any pain?
Yeah, without tablets, a lot of pain.
You use pain killers or such? What were you using previously?
Pregabalin.
Pregabalin.
Amitriptyline.
Oh yeah, they are the most powerful. Pregabalin is a very powerful painkiller, and amitriptyline is it is numbing the nerves.
Yeah.
To decrease the neural pain. We use it. It is the end point actually. You were in the edge, so and you were using some medications for bladder too, right?
Yeah.
And your life was unmanageable or intolerable. How many times a day you were going to toilet?
All the time.
Really?
Yeah.
Really?
Yeah.
And during night?
Maybe 3.
Okay.
Yeah.
So And did you have any problem during ejaculation, sexual activities?
I'm not sure because I was being given medication for erections, so I wasn't really sure if it was affecting that because I was having Cialis for the prostate, which also affects erections.
Yeah, okay. So it increases the erectile quality. So you were really in a in a bad situation,
Yeah.
and that's why you find me, and you find I do this cystitis treatment to women mainly. For men, I was always thinking prostate is a barrier. The infection cannot pass into bladder before you. I was thinking like that. You taught me, you teach me it's possible. Now, after you, I operated maybe 10 men, which my classic prostatitis treatment did not work. It was not enough. They improved, it come back again. Improved, come back again. So I said maybe there is some issues in the bladder. Also, they had some bladder symptoms like too much frequency, pain in the bladder. They feel it. So when I look to bladder in such cases, prostate inflammation may move into bladder, and you can treat prostate with squeezing the prostate, emptying the prostate, but you can't treat bladder because it is always in touch with the acid of the urine. So it is chronically irritated, and you have to touch bladder, it's something else. And fulguration works well. You feel the difference. You can say it worked for you, right?
Yeah.
Okay, so now my treatment has changed like that. If someone comes to me with a chronic infection, a man comes to me, I diagnose him actually for prostatitis. Sometimes we choose to do a cystoscopy beforehand to understand if it is also passed into the bladder, bladder is contaminated or not. Then if it is only in prostate, we treat the prostatitis. But if it is moved into the bladder, we offer to do the cystoscopy and fulguration. So what will our treatments, how it will continue? This time I am planning not to do cystoscopy, just I am planning to treat the prostate. But if we need, we can do office cystoscopy, which is easy, very easy. What's your opinion? What's your treatment plans when you are coming here?
I think just to repeat the prostate.
Yeah, prostate massage.
It usually helps for 2 to 3 months.
Yeah, and it will be longer that time.
Yeah.
So every time we empty the prostate, it takes longer time to refill, and I hope this time it will be longer, maybe 6 months. Then after 6 months, it will be 1 year, and then you will forget about it.
Let's
Fingers crossed. And did we use the Russian instruments last time?
Yeah.
Do you feel any benefit from this?
Yeah, I think it's better.
Yeah, because they heat the prostate.
It feels more relaxed.
Yeah, and there is a Chinese instrument, a recent new one.
Okay.
And it vibrates the prostate with little vibration. Yeah, sometimes if we cannot make any fluid coming out, can't drain properly, this instrument makes it. Yeah, it's because it's vibrates the prostate like this. Good, I like it. So Russian instruments usually hits the prostate, and the Chinese instrument vibrates. It's good. Also, it's you can buy it from Alibaba.
Yeah.
And I will show it to you. Maybe you can also use it yourself. The Russian instruments are more complex. It's not manageable in the home, but the Chinese instruments, maybe we can offer some people to use it. Okay, thank you for coming, and thank you for this record. I hope this will help some people. Thank you very much.
Okay, thanks.